The Erie County Department of Health now confirming a second case of measles in Erie County. Our Angelica Gallagher joining us here live in studio tonight with the latest from health experts and residents. Angelica.
Yeah, Rob, infectious disease experts say this latest case is sounding new alarms. The infected individual had no known link to last week's case and no recent travel outside of Erie County, raising concerns that the virus could be spreading locally without being detected.
These two cases could turn into a greater number of cases if we don't take this seriously.
The second case of measles confirmed in Erie County is raising concerns across western New York.
I knew that was happening in other parts of the country, but I wasn't aware that it was happening in Erie County.
I think people should take that very seriously.
Concerns infectious disease expert Dr. Thomas Russo says are warranted.
It's probably the most contagious of all infectious diseases.
Erie County health officials say the infected person visited several locations while contagious, including 1021 Broadway in Buffalo and the ER at Golisano Children's Hospital. Anyone who may have been exposed is being asked to watch for symptoms over the next 21 days, such as rash, fever, cough, and runny nose and eyes. And Dr. Russo says while exposure to those locations needs to be taken seriously, it doesn't end there.
The first case, the child was infected due to international travel to a country that has lots of ongoing measles cases at this time. But this second case, this individual did not travel. They acquired this in Western New York. So we may have more cases of measles in our community that we've actually diagnosed at this time. In fact, I think that's highly likely.
Beyond its ability to spread rapidly, Dr. Russo says measles can cause a range of severe complications.
Pneumonia, encephalitis, a decrease in immune protection, putting you at risk for other infections for months after you recover, and a rare but inevitably fatal long-term neurologic complication called SSPE.
With both confirmed cases linked to unvaccinated individuals, experts urge residents to protect themselves and others.
The best way to do that is if you've not been vaccinated, please do so as soon as possible. If you received both shots of the measles vaccination, it's highly unlikely that you'll contract measles if exposed.
Parents echoing this message.
Make sure that you are taking precautions, because when you don't, you put other kids and other families at risk.
I just really try to listen to my medical provider. The best thing is to be informed.
I want to make sure my kid is being surrounded by kids that are being cared for, being vaccinated, and because the price and the cost of that is that it could happen to you, and people think that it can't happen to them until it does.
Now, doctors say anyone who believes they may have been exposed or developed symptoms should call a healthcare professional before seeking treatment to avoid exposing other people. And they're also encouraging anyone unsure of their vaccination status to contact their doctor immediately. In the studio, Angelica Gallagher, News 4.